hello. You look frustrated. How can I help you?
Um, I bought this a couple days ago because I was recently diagnosed with type 2 diabetes, and my doctor told me to monitor my blood glucose level twice a day. I don't remember how this thing works. Would you mind showing it to me again?
Yeah, of course. I'm one of the many pharmacy technicians here that can show you. So let's look inside the box and see what we've got. Okay, so here is our meter, the test strips, the lancing device, and here we have our lancets. I have noticed that your device has already had this date and time set up. Do you remember how to do that?
No.
Okay, so right here you'll press and hold the OK button here, and numbers will pop up. By changing those numbers, you can use these arrows here. And once you're done choosing all the numbers there and setting the date, you press OK just to lock them in.
Okay.
And when you're starting, you'd want to prepare your lancet here. So by doing so, you'll twist the cap counterclockwise, and you'll pull the cap straight off like so.
Okay.
And right here, we'll have the spot is reserved for the lancet. We'll just grab one here, and we'll insert it in place here. And then right here, this is the protective cap. So you'll want to turn this protective cap one full turn, and then you'll want to pull it straight up. Okay. And you'll want to set this aside because you will want to cap this onto the lancet here, and then it's easier to dispose of.
Okay.
So now, after you've taken the protective cap off, you'll want to put this cap back onto the device. And then you'll set it like this, and you'll want to turn it clockwise,
Okay.
and you'll hear a click, and that means it's secure. Now, you'll want to cock the lancet by pulling this device here under the white button. Just pull it back, and if there's no click, that means your lancing device is already set. And so I just wanted to let you know about these numbers here and this wheel here. This is the settings for the depth of puncture.
Okay.
And it'll have numbers 1 to 7, and the smallest number is for shallower punctures, and the higher numbers are for deeper punctures.
Okay.
So you just set it to whatever you're comfortable with. So we'll set this aside, and then we'll just grab our test strips here. Grab one from the vial, and you'll want to insert the test strip just right here up on the top of the meter, and just push it in with the gold side facing you. Okay. So before you start using your lancing device, you would want to wash your hands with some warm soapy water,
Okay.
rinse, and dry completely. Okay. And so when using this device, you will want to put the cap side on the side of your finger here, and press the white button here to release the lancet. And just prepare yourself. You'll have a little poke right here, and then just remove it from your finger here and set it down. And then once you see some blood coming out, if there's not much coming out, you can always massage and squeeze just gently here. And then as a drop of blood is forming, you'll want to take your meter here, and you see that gold strip right there? You'll want to tilt it to the side here, and you'll want to leave it there until the little gold strip is completely filled with the blood. And then once that is filled, you will see your glucose levels appear on the screen here, and it'll appear with the unit of measure, the date and time that your test was taken.
Okay.
And so I wanted to show you about these colors here. There will be an arrow that will point to one of the 3 colors.
Okay.
The blue will indicate levels below your range. The red will indicate above your range, and the green will indicate within your range limit.
Okay.
Yeah. And so you can always write this down or record it however you want. And so after you're done using this lancing device, you want to take the cap off, like so, like how we've done before.
Okay.
And remember that protective cap that we saved?
Oh, yeah.
So you want to put it on a hard surface, like a table or something like that, and you'll want to point the lancing device down and just push hard right onto the protective cap, like so. And then right under the cocking control here, you'll have the ejection control.
Yeah.
So you'll want to push it towards the cocking control, and it should release the lancing device, like so. And if the lancet doesn't actually come out and it fails to, then you can just cock it back and then try again with the injection control,
Okay.
and then it should come out. Just try it again and again,
Yeah.
and it should come out. And so with disposing of these, you'll want to put it in a sharps container
Okay.
along with the test strip, because we don't want to. We want to avoid any unintended biohazardous accidents, of course. So are you comfortable with using this device at all?
Yeah.
Yeah, for sure. Do you have any questions at all?
No. I think you've go over the steps, procedure, really clear and well.
Yeah. So if you do have any questions in the future, don't hesitate to give us a call or anything, or come in and ask us some questions.
Okay. God.